The objectives of Lesson 11, Learners with Speech and Language Disorder are such follows. By the end of this lesson, the student teacher should be able to: first, affective. Reflect on their own capability and aptitude to teaching in mainstream classrooms in the future. Second, cognitive. Enumerate and describe the milestones in language development, the types of language disorders, criteria of communication disorders, and the special education programs for learners with speech and language disorders. Last, psychomotor. Display and practice the teaching and assessment strategies properly, not only for the benefit of the learner with special needs, but most importantly for the abled.
So, how do speech and language develop? According to studies, the first 3 years of the child is where the brain is at its peak in acquiring speech and language skills. It also helps the development of the child if he or she is exposed in a rich environment where they will get constant exposure to sound, especially in speech and language. If they are not given enough support and exposure during this period, it will make it harder for them to develop speech and language skills.
What are the milestones for speech and language development? Children may vary in their development of speech and language. There is, however, a natural progression or timetable for mastery of the skills for each language. The first signs of communication occur when an infant learns that a cry will bring food, comfort, and companionship. Newborns also begin to recognize important sounds in their environment, such as the voice of their mother or primary caretaker. As they grow, babies begin to sort out the speech sounds that compose the words of their language. By 6 months of age, most babies recognize the basic sounds of their native language.
While speech and language are both terms describing the way we communicate, there are some subtle differences between them. A speech disorder is a condition in which a person has a problem creating speech sounds when talking, while language disorder is a condition in which a person has a problem understanding the meaning of message and sharing their message. Children who have speech disorder are having a trouble to produce words or speech sounds correctly when talking. An example for this condition is stuttering. On the other hand, children who have language disorder don't have a problem with their speech sounds, but they have a problem understanding what the others is saying, having trouble in reading, or having a trouble sharing their thoughts. An example for this condition is dyslexia.
Here are examples of the different types of speech and language disorders.
AOS, or apraxia of speech, is a type of speech disorder happens when the neural pathway between the brain and person's speech function is lost or obscured. The person with this condition knows what they want to say. They can even write what they want to say on paper. However, the brain is unable to send the correct messages so that speech muscles can articulate what they want to say, even though the speech muscles themselves work just fine. Stuttering, also referred to as stammering, is so common that everyone knows what it sounds like and can easily recognize it. Everyone has probably had moments of stuttering at least once in their life. The National Institute of Deafness and Other Communication Disorders reports that of the up to 10% of children who do stutter, 3/4 of them will outgrow it.
Number 3 is dysarthria. According to clevelandclinic.org, Dysarthria is a motor speech disorder in which the muscles that are used to produce speech are damaged, paralyzed, or weakened. The person with dysarthria cannot control their tongue or voice box and may use slur words. Complications of dysarthria include social isolation and depression. In case of students, children with this condition may isolate themselves to their classmates and affect their learning development. The main symptoms of dysarthria is a change in the way the people talk, or may have trouble understanding because of the following: speaking more quickly or slowly, and even slowly than intended, having speech that becomes slurred, mumbled, robotic, or choppy, having difficulty moving the lips, jaw, or tongue, and lastly, sounding hoarse, breathy, or nasal. The next type is lisp. A lisp is a functional speech disorder that involves the inability to correctly pronounce one or more sibilant consonant sounds, usually letter S and Z. Usual sounds like th or the are substitute for the sibilants. The word student, for example, would be pronounced as student by someone with speech disorder. Many children lisp at certain ages at speech development, especially when they lose their front primary teeth. These children have trouble organizing the sounds of speech in common patterns and may consistently replace one sound with another. Another example, a child may say one instead of son or though instead of so. An unfortunate side effect of lisping is decreased self-esteem due to low or individual frustrations or peer bullying. While speech therapy techniques can help mitigate low self-esteem, it is important to have a strong support group set in place. This is true for both children and adults. But there are certain types of techniques to correct lisping. Number 1 is the awareness of lisping. Some people, especially younger children, may not be able to readily correct their lisping if they aren't aware of their differences in pronunciation. Speech therapists can increase this awareness by modeling proper and improper pronunciation, and then having the parent or your child identify the correct way of speaking. As a parent or loved one, you can use this technique at home to help enforce correct pronunciation without simply focusing on wrong speech that could cause further discouragement. The last technique is conversation. Conversation puts all together the previous exercises. At this stage, your child should be able to have a conversation with you or their peers without lisping. While conversation technique should be natural, you can practice at home by asking your child to tell you a story, or even a casual communication or conversation with you and their peers.
Spasmodic dysphonia is a chronic long-term disorder that affects the voice. It is characterized by a spasming of the vocal cords when a person attempts to speak and results in a voice that can be described as shaky, hoarse, groaning, tight, or jittery. It can cause the emphasis of speech to vary considerably. Based on my research and all of the videos that I found online, people who suffers from SD says that when they speak, it feels like air is coming inside of their lungs and it makes their voice box harder for them to speak. So moving on, the next speech disorder that we're going to talk about is cluttering. So what is cluttering? Cluttering involves speech that sounds rapid, unclear, or disorganized. The listeners may hear excessive breaks in the normal flow of speech that sound like disorganized speech planning, talking too fast, or simply being unsure of what one wants to say. So a common example of this is when you're confident and you know what to say on your mind during a recitation, but when you stood up and went in front of the class, all your thoughts are jumbled and you don't know what you really want to say to the class.
Number 7, muteness. Selective mutism. There are different kinds of mutism. And here we are talking about selective mutism. This used to be called elective mutism to emphasize its difference from disorders that cause mutism through damage to or irregularities in the speech process. Selective mutism is when a person does not speak in some or most 78 situations. However, that person is physically capable of speaking. It most often occurs in children and is commonly exemplified by a child speaking at home but not at school. Selective mutism is related to psychology. It appears in children who are very shy, who have an anxiety disorder, or who are going through a period of social withdrawal or isolation. These psychological factors have their own origins and should be dealt with through counseling or another type of psychological intervention. Number 8. Aphasia. Aphasia is a communication disorder caused by damage to the brain's language capabilities. Aphasia differs from apraxia of speech and dysarthria in that it solely pertains to the brain's speech and language center. As such, anyone can suffer from aphasia because brain damage can be caused by a number of factors. However, SLPs are most likely to encounter aphasia in adults, especially those who have a stroke. Other common causes of aphasia are brain tumors, traumatic brain injuries, and degenerative brain diseases.
The ninth types of speech and language disorder is speech delay or alalia. Speech delay, also known as alalia, refers to a delay in the development or use of the mechanisms that produce speech. Specifically, the alalia implies the partial or total inability to communicate through oral expression. People who suffer from it usually develop good abilities to express their ideas in writing, since it is usually the only source of communication. The last one is issues related to autism. But first, let's discuss about autism or autism spectrum disorder. Autism spectrum disorder or ASD is a neurodevelopmental disorder that begins in the first few years of life. In many cases, it is not diagnosed before the age of 3. ASD can impair your communication and social skills to varying degrees. The effects depend upon where your autism falls on the spectrum of severity. It can range from mild Asperger's syndrome to severe. People with mild ASD are usually fully functional in their daily lives and in society. Those with more severe forms of ASD may require ongoing care and support for their entire lives. Now, let's go to the complications of ASD or the issues related to ASD. First one is sensory problems. If you have ASD, you may be very sensitive to sensory input. Something as common as loud noises or bright lights may cause you significant emotional discomfort. Alternatively, you may not respond at all to some sensations such as extreme heat, cold, or pain. The second one is seizures. Seizures are common among people with ASD. They often begin in childhood or your teenage years. Seizure, formerly known as an epileptic seizure, is a period of symptoms due to abnormally excessive or synchronous neuronal activity in their brain. The third issue is mental health issues. Having ASD puts you at risk of depression, anxiety, impulsive behavior, and mood swings. The fourth one is mental impairment. Many people with ASD have some level of mental impairment. Children with Fragile X syndrome are more likely to develop ASD. This syndrome is caused by a defect on a section of the X chromosome. It's a common cause of mental impairment, particularly among boys. The last issue is tumor. Tuberous sclerosis is a rare disorder that causes benign tumors to grow in your organs, including your brain. The link between tuberous sclerosis and ASD is unclear. However, ASD rates are much higher among children with tuberous sclerosis than those without the condition. There's also other complications which are aggression, unusual sleep habits, unusual eating habits, and digestive issues.
Let us now proceed to the speech and language education programs in the Philippines. One example of a program is the CHED Memorandum Order Number 29, 2011, creating Bachelor of Science in Speech Language Pathology or BSSLP. In this memorandum, CHED discussed the policies, standards, and guideline for this course. This includes on what the course is all about, the preparation of the facilities, and what skills should the teacher have while teaching this course.
There are 7 teaching strategies that you should know about communicating with students that have speech and language disorders. The first one is helping children with articulation disorders to learn proper production of speech sounds. Students with articulation disorders are those who are having problems with making sounds and forming particular speech sounds properly. Example of how you can help them is that you focus on interactive communication, reduce distraction, talk around, and use sound cues. The second is helping children with stutter to speak more fluently by talking slower so that the student may benefit from hearing slower speech, and also a child who are told to slow down might get frustrated. The third one is assisting children with voice disorders to improve their voice quality by making them hydrated, teaching them breathing activities and relaxation activities for their neck and shoulder when they are talking. Fourth, helping individuals with aphasia to learn speech and language skills by reducing distracting noise in the environment, keeping papers and pencils or pens available, writing a keyword or a short sentence to help explain something, helping the person with aphasia create a book of words, pictures, and photos to assist with conversations. Well, aphasia is a condition that robs of your ability to communicate or impairment of language. Aphasia is always due to injury to the brain, most commonly with a stroke, but brain injuries resulting in aphasia may also arise from head trauma, from brain tumors, or from infections. Fifth, assisting individuals who have difficulty swallowing as a result of illness, surgery, stroke, or injury. Sixth, evaluating, selecting, and developing argumentative and alternative communication systems. AAC or argumentative and alternative communication are the ways how we share our ideas and feelings without talking. Like for example, someone writing in a notebook to answer a question, using gestures to communicate, pointing to pictures or push buttons on a computer that speaks for them. We use AAC every day, and especially for those who can speak or hear us. That's why it's important to evaluate, select, and develop AAC. And the last one is enhancing communication effectiveness by using open body language, like patting a friend on the back while complimenting him on his success, or arms uncrossed, standing with an open stance, or sitting on the edge of your seat and maintaining eye contact with the person you are talking to. And those are the 7 teaching strategies that you should know.
Assistive technology. Number 1. Learners with speech and language impairments have an array of computer software packages available to develop their speech and language skills. An example is First Words, a language program that has a number of applications for teaching those who are developing or reacquiring language functions. The program uses graphic presentations combined with synthesized speech to teach high-frequency nouns and is one of many software packages that can help develop both speech and language. Number 2. Learners with speech and language impairments may use augmentative or alternative communication or AAC. AAC is the use of symbols, aids, strategies, and techniques to enhance the communication process. This includes sign language and various communication boards, both manual and electronic, that are used by individuals with impaired oral motor skills. Some examples of AAC are: Number 1. Unaided communication systems. Unaided communication systems relies on the user's body to convey messages. Examples include gestures, body language, and/or sign language. Number 2. Low-tech AAC. Low-tech AAC is any type of aid that does not require batteries or electricity. This includes things like a simple pen and paper to write messages on, as well as picture boards that can be carried to aid communication. Number 3. High-tech AAC. High-tech AAC is any aid that requires electricity or batteries. This includes specialized devices, software, smartphone, applications, electronic communication boards, and keyboards.
Let us now move on to Lesson 12. Learners with physical disabilities, health impairments, and severe disabilities.
Here are the Lesson 12 learning objectives. By the end of this lesson, the student should be able to effective. Learn not to let a student with physical disabilities, health impairments, and severe disabilities feel excluded and pressured in a mainstream classroom venue. For cognitive, describe the types of physical disabilities and multiple disabilities. Identify and discuss chronic illnesses and health-related conditions and the teaching and assessment strategies of teachers for learners with these disabilities. Lastly, for psychomotor, share his or her insights to his or her students and fellow individuals about the right and appropriate character and appreciation for the learners with the special needs, such as those with physical disabilities, health impairments, and severe disabilities.
Here is the lesson overview for Lesson 12. Stephen Hawking was an English theoretical physicist whose theory of exploding black holes drew upon both relativity theory and quantum mechanics. He also worked with space-time singularities. In the early 1960s, Hawking contracted amyotrophic lateral sclerosis, an incurable degenerative neuromuscular disease. He continued to work despite the disease's progressively disabling effects. Through his life, author, theoretical physicist, and cosmologist, Stephen Hawking inspired many persons with disabilities to lead fulfilling lives.
Physical disability. Due to physical activities performed by children, and in some cases adults, can lead to unwanted occurrences that results to different injuries or worse, disabilities. From the smallest scratch or wounds to a chronic disability that affects the individual's way of living. Physical activity and mobility may be impaired by a number of conditions, some of which again are permanent and others of a temporary or intermittent nature. These conditions include: number 1 is the disease of cerebral palsy. Cerebral palsy is a group of permanent movement disorders that appear in early childhood. Often, symptoms include poor coordination, stiff and weak muscles. There may be problems with sensations, vision, hearing, swallowing, and speaking. Second is arthritis. Arthritis is the swelling and tenderness of one or more of your joints. The main symptoms of arthritis are joint pain and stiffness, which is typically worsened with age. Third is muscular dystrophy. Muscular dystrophy is a group of inherited diseases that damage and weaken your muscles over time. This damage and weakness due to the lack of a protein called dystrophin, which is necessary for normal muscle function. The absence of this protein can cause problems with walking, swallowing, and muscle coordination. Next is multiple sclerosis. Multiple sclerosis or MS is a potentially disease of the brain and spinal cord or central nervous system, leading the person with this disability unable to walk. Next is the infamous Parkinson's disease. Parkinson's disease is a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Parkinson's symptoms usually begin to gradually and get worse over time. As the disease progresses, people may have difficulty with walking and again with talking. Next is repetitive strain injury or RSI. RSI is a general term used to describe the pain felt in muscles, nerves, and tendons caused by repetitive movement and overuse. It is also known as work-related upper limb disorder or non-specific upper limb pain. Lastly, the stroke. The last one is stroke. Stroke may result in temporary or permanent loss of feeling or movement of part of the body, frequently on one side only. Types of physical disabilities. Physical disability is defined by the Equality Act of 2010 as a limitation on a person's physical functioning, mobility, dexterity, or stamina that has a long-term negative effect on the ability to do daily activities. When you consider the huge number of possible causes of physical disabilities, you can quickly see how it is impossible to provide a comprehensive list naming each condition. Additionally, one physical condition may be considered disabling to one person, but not the next. The effects of a physical activity on a child's experience of life and learning varies even for people with the same diagnosis or condition. Some physical disabilities may be mild, or other symptoms may fluctuate. If we future teachers and wanted to teach students with disabilities, we'll think how about we can help them or how we can support them to be in the class, learning with others. We must also raise our expectations since most of the time, these children with special needs can achieve more than we originally think. Let's always have the thinking that they can do it and they will succeed.
Let us move on to teaching strategies. Here are a list of different strategies that we can learn from. In the first bullet, it states that the teacher must be considerate and understanding if their students are late or absent, especially if they have a movement impairment. Since it is harder for them to move, it may take them longer to move from one classroom to another. On the second bullet, we must ensure that the activities that will be done outside of campus will be accessible for all people. This is so that they won't be left out. It is also good practice to always prepare videos as alternatives in most situations. The third and fourth bullet talks about the convenience of the students inside the classroom. This includes specialized chairs made for them or their preference to stand during class if they suffer from back pain. On the fifth bullet, it says that it is good practice to record during your lectures. This is beneficial especially to those who are having trouble processing information and for students who are absent due to their disability. In this pandemic, teachers in online class record their meeting so that the students who were not able to join are able to watch the video in their own time. On the sixth bullet, learners may need extensions to deadline for work involving locating and using library resources. Teachers should also provide the students learning materials and readings in advance so that the students can read them beforehand. For the final bullet, academic isolation may be an issue for learners who are unable to participate in some class activities. Since some people have disabilities that hinders them from joining some class discussions or activities, it is good to have one-on-one sessions with a tutor to help them fill this gap in participation.
We have 5 assessment strategies that we can use in assessing learners with physical disabilities, health impairments, and severe disabilities. First one is a reader or an oral examination are alternatives to the conventional written paper. An oral examination is not an easy option for learners. Give the same time for an oral examination as for a written exam, but allow extra time for the learner to listen to and refine or edit responses. The second one is, for some learners, the combination of written and oral examination will be the most appropriate. Allow them to write answer plans or make outline notes, but then to answer the question orally. Third, learners may need to use a personal computer or a personal assistant in an examination. If so, it may be necessary to provide extra space for equipment or a separate examination venue if the noise from equipment is likely to be distracting for other learners. The second to the last is provide extra time in examinations for learners who have reduced writing speed. Some with a mobility disability may need rest breaks. The last one is allow extensions to assignment deadlines if extensive research involving physical activity is required. And those are the 5 assessment strategies that you can use in assessing learners with physical disabilities, health impairments, and severe disabilities.
The term multiple disabilities refers to a disability in one or more areas of functioning that significantly limit a learner's ability to learn and achieve success in academic settings or limit the performance of major life activities. The label of multiple disabilities can include challenges in one or more of the following areas: cognition, communication, fine motor skills, mobility or gross motor skills, etc. Some examples of multiple disabilities are deaf blindness, mental retardation blindness, severe disabilities. These learners require ongoing extensive support in more than major life activity in order to participate in integrated community settings and enjoy the quality of life available to people with fewer or no disabilities.
Teaching strategies. Determining an appropriate educational program for a learner with multiple disabilities can be a daunting task due to the variety of pervasive supports they need. The planning process should be a multidisciplinary process, including parents, teachers, physical therapists, assistive technology teachers, and any number of additional support staff. Of course, at the center of the planning process should be the learner, and his strengths and desires should guide the entire process. Specific steps to success need to be identified and timelines set for each educational objective. In addition, resources and supports needed for the learner to achieve his goals should be defined and addressed. One area of support that can be particularly effective for all involved is peer tutoring. Peer tutoring has been proven to have positive results for learners with multiple disabilities in a number of separate research studies. However, care must be taken that the tutoring is not a one-way relationship but is reciprocal. The learner with multiple disabilities should also be able to provide something to the tutoring process, even if it is a simple social behavior, Some training on both sides will be necessary to make this a fruitful support system.
Health impairments. Let us begin by defining the term impairment. According to several dictionaries, impairment is the state of being impaired, meaning being damaged, imperfect, or in weakened state and condition. Proceeding to the main topic, the OHI or other health impairments. It is a term that covers a wide range of concepts. As for OHI, it encompasses many different types of impairments due to acute or chronic health problems, limiting the learner's ability to fully access the educational environment, and also affecting the learner's academic performance due to limited alertness, strength, and vitality. Other health impairments has a wide range of characteristics. For example, students may have attention deficit disorder, or other students are exposed with conditions like diabetes, cardiovascular diseases, and students with asthma and breathing difficulties. There will be times that these health problems will be their primary problems during the learning process. Students with health impairments is also exposed to other several challenges. It includes safety issues inside or outside the classroom. Just like a student with epilepsy, teachers must provide special attention more than their other students since this specific condition requires effort to provide the students' learning needs, and this can also be applied with students in different conditions.
Let us proceed to its teaching strategies. On the first bullet, it says that we should provide a breathing time for our students from proceeding to the next lesson. This is to avoid them from having information overload. On the second bullet, it is all about giving them helpful tips on how to be organized. Aside from the students, the classroom itself must be organized. There should be a dedicated area for each material for easier access. On the third bullet, it tells us to be considerate to students who have health impairments by giving them extra time for their homeworks and tests. For the fourth bullet, it is pretty much straightforward. If the set of instructions and activities are complex, let us simplify it to make it easier for them to understand. This will also avoid confusion in the class. Fifth bullet states that the learners with health impairment must be seated near the teacher to avoid getting distracted by their friends. On the sixth and seventh bullet, it tells us to prepare a weekly schedule and its daily activity. This will help students keep track of their schedule and have preparations for those activities. As teachers, we must also be consistent with the schedule that we give our students to avoid giving them inconveniences.